अस्सलाम वालेकुम इय्याका नअब्दु व इय्याका नस्तईन। तो आज मैं मेडिसन 24th में आफ्टरनून का SK16 का पेपर करने जा रहा हूँ। तो लेट्स स्टार्ट। क्वेश्चन नंबर 1, a 45-year-old patient is on hypertensive drugs presenting with the increase in the LFT and indirect bilirubin. Which drug is responsible? There's methyl dopa. Next, question number 2, internal spermatic fascia is derived from fascia transversalis. Question number 4, if the patient 25% nephron is working, what will happen in the remaining nephron? Increase GFR in the remaining nephron. 5, shortest half life is which of the following hormone? GnRH. A patient presented with the Crohn's disease, for her treatment of the remission, corticosteroids are given. What is the best for the maintenance of the remission? That is azathioprine. 7, cyanide poisoning will affect which complex of electron transport chain? That is the complex number 4. Question number 8, TB is involved in hypersensitivity. Next, 9, a patient after taking an analgesic overdose have hyperventilation, tachycardia, metabolic acidosis. Most likely the drug is acetyl salicylic acid. Question number 10, a patient went to Thailand and on return present with a diarrhea which is watery. As donor shaped cyst basically, and this is alpha, which is sporodiosis. Next, question number 11, increase in the right arterial pressure, increase mean arterial systemic pressure, decrease venous resistance. The cause is exercise. 12, in asthma patient having the Krebs, what parameter will decrease? That is decrease FEV1. 13, a patient has decreased FEV1 and decreased FRC, decreased FVC, and has the chronic cough with dyspnea, which is related to the chronic bronchitis. Question number 14, a patient has the right flank mass, hematuria, proteinuria. What will you suspect the increased erythropoietin? 15, sodium potassium ATPase inhibition the cardiac cell lead to the increased intracellular calcium. 6, features which differentiate full-blown carcinoma from the carcinoma in situ, that is basically the Charlie, which is the invasion of the basement membrane. 17, the first step in the beginning of the cancer is the invasion degradation of ECM and the components of the basement membrane. 18, the patient has the history of 60-pack cigarette smoking in the developed mesothelioma. Risk factor for it would be the asbestos. 19, a baby has some cardiac abnormality. She has machinery murmur on auscultation, that would the PDA murmur. 20, regarding niacin, true is gives CNS effects. 21, the Babinski negative usually seen in the after 2 years. Anti-gravity muscles which stabilize you when you stand are controlled by Charlie, which is the spinal cord. Next, 23, a woman of the 30-year-old needs renal transplantation. 5 donors came up for her, which is the following the best match of donor transplant is her identical twin. Drug of choice in the pseudomonas pseudomembranous colitis, that is vancomycin. 25, man sport of the medial longitudinal arch of foot is formed by which structure? That is a talus. Next, 26, the woman develops a carbuncle on the back of her neck, which is removed by the surgeon. Which type of the necrosis and inflammation is present? That is acute. It must be liquefactive basically. 27, neck veins normally don't distend, they distend when right arterial pressure rises above, that is alpha. 8 plus. 28, the amniocentesis cannot be done before 10 weeks. 29, the surface of the left lung contains a groove for the arch of aorta. 30, at aortic opening, dilatation of aorta, damage to the thoracic duct and esophagus vein. 31, during the thoracic surgical procedure, the surgeon should care the structure while ligating the internal thoracic artery. The structure likely is the ipsilateral pharynx nerve. 32, if radial trunk is cut at the origin, what will happen? It will lead to the wrist drop. 33, if the pharynx nerve is cut at its origin, will lead to the ipsilateral diaphragm paralysis. 34, which muscle is supplied by the median and the ulnar, both the flexitorium profundus. Arc of aorta wholly lies in the superior mediastinum. 36, the cardiac surgeon performing open heart surgery, what structure has he should be care of in anterior to mediastinum? That is the thymus. 37, there is no edema due to the increased aldosterone because of Charlie, that is escape mechanism. 38, outline of cell is preserved in which of the following necrosis? That is the coagulative necrosis. Level of education of the reproductive knowledge is that is Charlie. Lower secondary, if tested, remove what effect will occur? Testis removed, it will lead to the decreased libido and irritability. 41, the hormone inhibiting FSH by the released by the testes. 42, the body metabolic response to trauma, skeletal muscle respond by the increased proteolysis. If a cell is arrested in the G1 phase, later develop uncontrollable mitotic activity. What gene is affected? That is the P53. 44, the sinusoids in the liver are lined by delta discontinuous fenestration endothelium tight cells of the adrenal gland parenchyma related to which of these? That is alpha, which is mesothelium. Next, 46, development of anterior pituitary gland is from the outpouching from the stomodium. 47 anterior to third general sensation is carried by the trigeminal nerve. Next 48 nerve damage during the submandibular gland surgery is the Charlie mandibular branch of facial nerve. And next 49 the thyroid hormone receptor presence in which of the following, that is alpha, which is inside the nucleus. Next 49 which hormone is responsible for the increased gastric acid secretion, that is the gastrin. Next a lengthy scenario, and it is linked to the bicarb and the chloride shift, where on endoscopy gastritis and the gastric ulcers were found, and the reason behind the gastritis was bicarb and chloride shift. 51 the test used to best monitor hep B is the SGPT. 52 beta cell markers used for their identification in the tumor are the CD1920. Recent thrombus consist of fibrin. 5-year-old male presented with epistaxis bleeding time more than 20 and increased acidity. Most suitable diagnosis would be the von Willebrand disease. 55 the prostacyclin is produced by the endothelial cells. The patient presented with the joint symptoms like the low-grade fever. ANA screen was done, that was negative, and only RNP antibodies were positive. This is seen in the mixed connective tissue disorder. Then a lengthy scenario of a link to the cricket match at the Kingston Oval, and it is basically the pericarditis. This is the frequently repeated question. You have to basically sort of ratify it. 58 in patient having the skin fibrosis in the joint pain, which finding will be seen the joint deformity. 28-year-old male presented with the nicotinic acid for his hypercholesterolemia. Noticed yellow discoloration of the sclera. After a few days, lab investigation showed the HP11, serum bilirubin 3, and the reg bilirubin 0.8. ALT 35. The most likely cause is the drug-induced hepatitis. Next, the medial surface of the frontal and the parietal lobe is supplied by the Charlie ACA. Next, sudden right side hemiplegia, bleeding from the internal capsule in the basal ganglia, which artery is damaged, that is the MCA. If the light thrown in the left eye, absent light reflex in the both eyes. When light reflex from the right eye, reflex is present in the both eyes. Injury is at the level of the pretectum regarding visual tract. True is all optic nerve and the lateral genital body. Next 64 the definite diagnosis of pneumonia is by which of the following? The sputum culture. 65-year-old present previous healthy life with a pulmonary congestion and failing heart. For one examination BP is this: afebrile glucose 86, cholesterol 185, CPK not raised. X-ray shows pulmonary edema, left prominent heart border. Diagnosis would be the calcified bicuspid aortic valve. 66 is the following diagnostic criteria for the sarcoma, that is increased viscosity. 67 the subacnoid space will end at basically S2 level. Next 60 autosomal dominant is the Marfan syndrome. The Vibrio cholera causes diarrhea due to chloride and increased secretion. 70 pregnant lady of the third trimester having the unchanged growth hormone. 71 the 41-year-old lady presented with the hepatitis, splenomegaly, proctitis, and thalassemia, jaundice for the last 3 months. Most appropriate investigation would be the AMA, antimitochondrial antibodies sensitive to pressure at the 10 cm water of the PEEP for the 24 hours would cause spontaneous pneumothorax. 73 patient having SVT effect of the vagal maneuver will be delta increase in the PR interval. In hemorrhage, which part of the nephron is most commonly affected? That is the proximal convoluted tubule. 75 patient after artery having the blood loss and develop hypovolemic shock. Histological finding in this patient's kidney would be the acute tubular necrosis, granulomatously in the bladder. After a few years progress by the carcinoma. This is caused by the schistosomiasis. 77-year-old presented with the fatigue, weakness, and dyspnea. The lab shows decreased calcium, increased phosphate, raised creatinine, and the increased PTH. This is due to CRF, renal failure. 78 the carbon-dioxide transport is regulated by the Charlie negative feedback. Liver carcinoma is caused by Charlie, which is the aflatoxin. 80 the fastest regeneration occurs in the liver. 81 which of the following are the spore forming bacteria, that is Clostridium tetani. 82 the patient presented the muscle weakness, not improved the nystigmine. Autoantibodies against the voltage gated calcium channels. What is your diagnosis? That is the Lambert-Eaton syndrome. Root value of the femoral nerve is Charlie L2 L3 L4. 84 regulation of the GFR is by the tuberoglomerular mechanisms. Which of the following is released at the synapse between the incoming pain fibers and pain inhibitory fibers in the spinal cord? That is delta, which is enkephalin. 86 the cause of the pulmonary edema in the ISD and the diabetes is the increased hydrostatic pressure. 87 athletes have enlarged heart comparatively and increased stroke volume. Instead their muscles need same amount of energy and having cardiac output approximately same as that in the normal individual. What can be a reason for this phenomenon? That is a decreased heart rate and increased SV. 88 the contact dermatitis has the following hypersensitivity: late hypersensitivity, young boy with the complaints of mild fever in the pharyngeal. meningitis examination shows the white membrane. Bleeds on removal, that is basically corynebacterial diphtheria. 90, the climber at the high altitude experiencing hypothermia and returning base camps. Adapt to cold weather by heat generation due to which of the following the posterior hypothalamus. 91, most common skin cancer in HIV patients is the Kaposi sarcoma. PT is used for the jaundice. Patient is taking warfarin, starting to bleed. What is the treatment of it? That is gonna be the vitamin K. 94, the patient taking warfarin 5 mg daily. What should be checked? That is the PT. A 10-year-old by diagnosed with the tapeworm infestation, the drug of choice would be niclosamide. ECG of the patient shows no association between the PR waves and had a history of the fainting. This is due to the third degree heart block, no association between the PR wave. The patient presenting the semi-conscious condition with the subclavian steal syndrome, the blood supply to which artery is causing this symptom? The vertebral artery. Right shift of the oxygen dissociation curve is caused by the beta decreased pH of patient. Blood is agglutinates with which antisera A and the B and contain agglutinin B. The blood group of the patient would be A positive. The abductor of the vocal cord is posterior cricoretina. Next, 101, the patient while awake with eyes closed, which waves will be seen on the EEG? That is the alpha waves. Patient after 1 year of the gastrectomy has anemia, raised MCV and heavy the peripheral numbness, tingling sensation. Weight above anemia is suffering from. He is suffering from the pernicious anemia or the vitamin B12 deficiency anemia. 103, the female had the hand swollen in the neck and is now 20 years of age with amenorrhea and absent secondary sexual. There is a Turner syndrome. 104, the metabolic acidosis is caused by which of the following? That is definitely the carbonic anhydrase inhibitor. The patient of the asthma having ABGPA 7.2, bicarb 2.6 and hypercapnia. Likely acid-base disorder would be the respiratory acidosis. Side effects of the dicumarole is the delayed clotting. Next, inherited decreased potassium is associated with the familial periodic pulses mechanism of action of the benzodiazepine, the potentiation of GABA. 48-year-old lady at the last stage of the carcinoma fibroid and that tells you not to tell her family. The son asked about her mother's condition and disease. What will you do? Basically, we will tell nothing. In a male breast carcinoma and the gynecomastia is produced by the prolactin Ig receptor is present. On the mast cell and viral infection, there is increase in the lymphocytes. Sarcomere is present between the two Z lines. The patient is unable to perform rapid movement of the hand, paws, pointing finger, nose test. That is the dysradiocognesia. Increase in the venous return with the increase in the vagal tone. Next, diabetic nephropathy is diagnosed by the Charlie microalbuminemia. CSF examination necessary to rule out retinoblastoma. 118, which of the cell increase in the parasitic infestations? That is the eosinophil. Right bundle branch of the conducting system of heart is present in the septomarginal trabecula. 120, the child was having a fever, cough and upper lobe consultations. He developed the respiratory distress. ETD cannot be passed and he had the laryngotracheobronchitis. What is the most likely cause of this notorious condition? That is H. influenzae. It must be parainfluenza basically. 121, the nerve compression between the C5 and C6 complex. Which of the following? That is C6. ACE inhibitors is given to a patient, increase the random bradykinin. By which mechanism? Bradykinin increase by this drug, stimulate catenin mechanism. And next, 123, the 60-year-old male presented OPD the complaint of the hematuria, increased unit frequency of the DRE. There is a stony hard mass felt in the prostate. Lymphatic drainage of it would be internal, like in the sacral. 124, the regarding thalassemia true is the defect in the beta group instances. 125, which one will be activated when the MAP is less than 60 mm of Hg? That is basically the CNS ischemic response. Next, 126, the botulinum toxin A and B inhibit the release of acetylcholine while SNAP25, the second order neuron of the anterior spinothalamic tract line the substantia gelatinosa. 25-year-old male with the swelling at the left wing, one region, a positive cough impulse in the moves when ipsilateral testis is retracted downward. It is painful. This is likely due to the inguinal hernia. You have to rectify this. 129, the indication to start the combined oral contraceptive pill is migraine. A patient wants to avoid the bitter taste of the medicine tablets. What will you tell him? Avoid touching the posterior most part of the tongue. Transplant from the identical twin is basically the isograft. Schistosomiasis cause this which of the following? Urinary bladder infections. 133, the peripheral chemoreceptors are stimulated by the decreased oxygen. 134, saliva helps in the digestion and is secreted by the VIP. Minus salivary gland nerve supply is the fascial. 136, brachial plexus division is done by the pectoral minus muscle. 137, the hormones for the glycolysis, gluconeogenesis and the ketogenesis is the glucagon. Next 138, the beta adrenergic cause. Which of the following affect the cardiac acceleration? And 139, the complete transaction of the brainstem above the pons would lead to prevent any voluntary holding of the breath. 140, the two vertebral arteries join to form the basilar artery. This is called the convergent. 141, the lateral ventricles are separated by the beta septum pellucidum. REM sleep waves. This is the beta wave. Next 143, difficulty in the swelling after stroke is due to the lesion in the nucleus ambiguous. Best cell of the sample factually matching prior to the renal transplant would be the white blood cells. 145, the oxygen delivery tissue is decreased by the carbon monoxide poisoning. 146, the female 40-year-old female with a heavy bleeding since 6 months ago on and off endometrial biopsy shows endometrial hyperplasia. The cause will be the estrogen. Right and left lobe of the liver is divided by Charlie, which is the middle hepatic vein. Fat pad of the upper eyelid is anterior to which there is elevated aponeurosis. 149, type of necrosis in the breast trauma is the fatty necrosis. 150, what is the inheritance pattern of the hemophilia A, that is the X-linked recessive. 151, regarding lesser pelvis outlet is bounded by the sacrotuberous and sacrospinous. 152, which of the following the system affected by the first by the radiation, that is the hematopoietic system. Next, cold agglutinin pneumonia is caused by the mycoplasma. Next 154, which one causes the lymphoma with the MYC amplification, that is the Epstein-Barr virus. Myogenic vascular response to hypertension is the vasoconstriction. 156, in vascular smooth muscle, the myogenic response is relaxation. The response to nitrogen oxide, histamine, and prostacyclin. 157, the most common presentation of the carcinoid syndrome is delta, which is a cutaneous flushing, which is produced by the carcinoid tumor, that is the statin. After RTA, patient presents the loss of the light touch and the pressure on the left side. Know that sensitivity of the motor loss. Surgeon orders MRI because he is suspecting damage of right-sided ventrospinothalamic tract. Benzodiazepine, barbiturates, and other anticonvulsants work by acting on which neurotransmitter? The GABA. A patient with a cardiac abnormality, facial anomalies, thymic aplasia, hypoplasia, and the cleft palate, all are the features of basically Catch 22. 162, the child with a mental retardation, umbilical hernia, protruded tongue, likely diagnosis would be the Down syndrome. Patient after the lesion of the caudate bottom and loss of GABA neurons, the substantia nigra, and the globus pallidus. Patient is suffering from the chorea, Huntington disease. Thank you for watching this video. Until my next video, Allah Hafiz.